Hello, this is Dr. Frank Springob, the co-developer and instructor of Morphogenic Field Technique. And we've been teaching Morphogenic Field Technique primarily in the Northwest for the last 4 years. It's a system of muscle response testing. It's a little bit different though. We use energy signature matching, and we use the morphogenic field of the body to get information about developing nutritional protocols. So our name morphogenic field came from Dr. Royal Lee's paper on protomorphogens. We use the field, just as he described, morphogenesis, in order to draw information about the nutritional needs of the person and to also identify possible toxicities. Our mode of testing is unlike others in that we do cellular energy testing as opposed to most muscle response testing techniques which do organ testing. So we're going to give you a little taste today of what we're going to learn when we do morphogenic field technique testing. Okay. All right. So first we're going to start by doing our disclaimer. So we're going to read the first paragraph here. The information presented is expressly intended for healthcare professionals only, not necessarily the opinions of Standard Process or MedHerb. Statements have not been approved by the FDA and do not claim to treat or diagnose any disease. The information that follows should not be construed as a claim or representation that any product or procedure mentioned constitutes a specific cure, palliative or ameliorative for any condition. So that's as much as that as we're going to read. So let's talk about morphogenic field technique. We're going to talk about the founders and developers, which is me over on the left side there, Frank Springob, DC, and then the person with the big idea was Autumn Smith, who was a nutritional therapist in our office. I practice chiropractic in Port Angeles, Washington for the past 37 plus years, and we've used every type of muscle testing technique imaginable to get information from the nervous system. I've had a consistently large chiropractic nutrition practice over the last 30 years that averaged approximately 200 patient visits per week. I've attended over 100 CEU classes with emphasis on importance of proper nutrition in the healing process. We consistently tried to develop new innovative ways to treat the person right in front of us, and we've come up with this technique, which we believe is the best one that's been developed to date. It was all based upon Autumn's inspired idea that we should be doing testing using the cell energy of the body. And when we did this, we also found that the best way to use those cell energies was to work within the body's energy field. So this is how we originally developed morphogenic field technique. Here's our contact information. Boulevard Natural Wellness Center is my office. We have a website, www.m-field.info, where you can get the information you need about morphogenic field technique. We have phone numbers there as well. However, if you want to really contact us and get a response, the best way is to use our email address, which is morphogenic@live.com. This is also how people contact us to get some of their supplies, posters, and seminar information. We begin every seminar with what we call our epigenetic candle. And as you can see by looking at the candle, it's small, but it's got a very long, bright flame, which is the way we think life should be. A candle that burns down to the very end with a nice, bright flame indicating good health and vitality, and then when it reaches the end, it flickers a couple times and goes out. So this is based on the idea of controlling your environment and therefore controlling your health and how your genes express. It's a concept called epigenetics, and we've been talking about it in our seminars for about 4 years now, and the seminars I've attended, other practitioners seem to be glomming onto this concept of controlling your genetic expression by controlling your environment, because it is the environmental factors that help determine how the genes express. This idea came about after the Human Genome Project when they were expecting about 100,000 genes. What they found was about 25,000 genes. Their belief was that they would have one gene for each protein the body created. So they needed a new theory. What they learned was each gene has the potential to create up to 2,000 different types of protein, and the process of generating the genes depended on multiple factors, and most of those factors on how the genes expressed were environmental factors. So MFT focuses on controlling that environment. Our number one tool is nutrition. But we want everybody to understand, both practitioners and patients, that your genes are not your fate. You have a great deal of control over the expression. About 98% of human diseases are to some degree epigenetic. So here are some of the epigenetic factors that MFT addresses during the seminars. Of course, nutrition. We're tied in with standard process because they have the nutrition that matches the human energy signature to the best degree. And other factors, emotional stress, outside electromagnetic fields, which is getting to be an increasingly important consideration, especially in the United States. We've got problems with overexposure to Wi-Fi, cell phones, and now they've got these smart meters, which we've been doing some research on. Heavy metal toxicity, mercury and aluminum primarily, but also others. Chemical exposure, we've got about 12,000 approved chemicals in our food supply. Processed foods, of course, which Roy Lee has talked about for his entire career. And now we've got the new additional stress of genetically modified foods, which do not match the body's energy fields. So everybody's been eating these things, and processed food now, about 80% of those contain genetically modified ingredients. And then the one thing we're particularly proud of is our ability to handle immune stress, especially from parasitic energies, which we call detrimentals. We have a very efficient way of identifying these stresses in the body and the best nutrition to handle those. So what is MFT? Well, it's a symbiotic combination of energy healing and nutritional healing. The energy field in our technique is used to find both foundational and clinical nutritional needs at the cell level using a form of muscle response testing that's modified. Because we're working out in the field, we're not on the body much of the time, and so we call it modified muscle response testing. And we consider the morphogenic field to be an extension of the healing energy of the nervous system. So here's a visualization of the field, and as you can see, it's not one field, it's fields within fields. So there's heart fields, there's nervous system fields, kidney fields, liver fields, and they all combine to create the larger field. So we want people to start thinking in these terms as they work on their healing. Our kits use the field to draw information. We'll talk a little bit more about the individual kits, but the attraction to the field by the kits is the indicator that we need to develop a nutritional protocol to resolve those problems. So the goal of our procedure is the expansion of the field and also the balancing of the field. People will come in, sometimes they'll have a rather small energy field, sometimes balanced but small, sometimes large in the front but small in the back or on the sides. We want a large balanced energy field about 5 to 7 feet off the body on all sides. We do the measuring of the field with 2 standard process products. Simplex M, if you're a female, your body will reject Simplex M. Since it's not designed for you, it's a supplement for the male endocrine system. And at that point of rejection, that is the boundary of the field. And then if you're male, we use Simplex F for the same principle. So if the field is grown and becomes more balanced at the end of the procedure, then you know that you've accomplished your goal and that your nutritional protocol is correct. So why does this work? Well, according to the laws of quantum physics, everything has an energy signature or a resonance. And so the M field represents an extension of the nervous system, and it's searching the environment for matching or mismatching resonance. It wants to avoid things that don't match its energy signature. The autonomic nervous system should react negatively to mismatch resonances, and there should be a rejection. and conversely it'll react positive to a matching resonance, and if that happens, the muscles will stay strong. So as our test kits search for a matching resonance, we are looking for a strong muscle lock, because at the end of the procedure, your body will reject all of the energies in the test kits if you've done the procedure properly. So as far as I know, this is the only muscle response testing technique where strong is the indicator that we need to do something, and weak means that there's nothing to be done, as opposed to most of these other seminars that you will attend where you're looking for a weakness first and then attempting to make it strong. It's just the opposite of that. And when you do work in the field, you will have a different outcome in your protocol development than you will with other types of techniques. And we feel it's more accurate, it's more efficient, the protocols are more targeted to the real energy of the body. So we're trying to gain information about the health status of the patient based on the muscle response test. And because we're dealing with energy, it becomes a difficult communication for mainstream people to kind of open their minds to it. So it requires a little bit of patient education and introduction. In the seminars we talk about how we introduce morphogenic field testing and get the patient to expand their thinking to include what's unseen. We believe that the muscle response test is like a portal into a quantum realm for the purpose of nutritional healing that you can't access in any other way. So therefore, you're going to get results using this technique that you would not get using any other type of technique. So any knowledge gained from the muscle testing experience is used by the tester to assist in the decision making, and it's always a snapshot in time. So by that I mean, for example, everybody knows that a good organic carrot is good for you unless you just ate 10 of them, in which case, you know, your body would probably not ask for a carrot. So therefore, before you ate the carrot, your body would agree to a good organic carrot, whereas after 10 carrots, your body would say, no, I don't need that. So it's always a snapshot in time when you're doing muscle response testing. We gather this information in our structured way, and we use some other complementary healthcare procedures to assist in our assessment of the nutritional needs of the patient. So there's an increasing interest in the healthcare community for simple non-invasive procedures that get information from the body. And the manual muscle test is an excellent tool to assist in that objective. We also realize there's a lot of practitioners out there that may never be muscle response testers. So with the help of Dr. Nick Lamoth, we've also developed a Zyto version of MFT, which although it's pretty efficient, it doesn't quite come up to what you can accomplish with a good muscle test, but still in all, it's about 90–95% effective. So also there's a growing interest in the use of whole food nutrition. You see many more products on the market that call themselves whole food nutrition as a solution to improving health. Standard process is the gold standard for this, though, and you see so many nutrition companies comparing themselves to standard process, but they don't compare favorably in many cases. Although we use a few products that are not standard process, about 90% of our products are standard process because these are the ones that really match our concept of energy signature matching. Okay, so the synopsis of the introduction here: we support the epigenetic premise that humans have the ability to take control of their health by controlling their environment. We do not need to be the victims of our genes. Muscle testing techniques are valuable to gather information from the body to help assess nutritional and other needs besides that. Informational healing techniques such as MFT are essential for optimal epigenetic outcomes. You will find, if you do MFT, that you'll get results, and then you'll think back and think, without this type of testing procedure, how would I have ever known what to do with this patient and get the outcome that I've gotten? So best way to get great outcomes is ask the field. So here's the topics for the rest of the webinar. We're going to discuss briefly the history and evolution of muscle response testing. We're going to talk about the information provided at the level for the practitioners when they use muscle response testing techniques. We're going to talk about the difference between foundational nutrition and clinical nutrition. We're going to give a short synopsis of the MFT testing procedure. We're going to introduce the participants of the webinar to the MFT seminar series that teaches our concepts. And we're going to discuss some of the standard process foundational supplements that will be used in the basic MFT procedure seminar. So our first class teaches mastery of the basic technique and the concepts of foundational nutritional healing, and then later in the seminar we talk about clinical aspects. So this is what our two main classes look like. The MFT basic procedure is a 12-hour class over a 2-day period, and the lectures cover the theories of epigenetics, basic physics concepts, brief history of muscle response testing, and our contribution to that. And then we move into learning the 27 easy steps of the MFT basic procedure. During the weekend we have 6 hands-on workshops so the attendees can master the procedure, and also we have an opportunity for the attendees to be tested themselves using the procedure and develop their nutritional protocols. We like to get the whole procedure done in 3 to 5 minutes. Most of us are, I'm a chiropractor, I adjust people, I book people about every 15 minutes, and I have a large nutrition practice. So I want to be able to get all that done, and you can do the entire MFT procedure in 3 to 5 minutes, and you can do it quite easily. Many times it takes less than 3 minutes. In the advanced procedure, we teach 45 additional clinical procedures, and we use condition labels to treat people from an energetic nutritional perspective. We're also going to teach some practice management concepts. And when we do one type of testing called special situations, we have a kit that has labels of many of the conditions that people come in and complain about. So it's always nice when these people learn that some of these medical conditions are really best handled with proper nutrition. So we want people to get that nutrition will bring health, whereas pharmaceuticals will simply mask symptoms. So talking about the muscle testing history and evolution. So the first documented use of manual muscle testing was found in the Journal of the American Medical Association in 1914. So muscle testing is about 100 years old. And there was a peer-reviewed paper that discussed using it to determine the integrity of nerve innervation at different nerve root levels in the spine. About 50 years later, along came Dr. George Goodhart, chiropractor from Michigan, and he introduced the profession to his new science of applied kinesiology in 1964. So we've been using muscle response testing for about 50 years to develop nutritional protocols, beginning with Dr. Goodhart. When I was in chiropractic school in the early 70s, it was just making its way into the chiropractic colleges, although we had to learn it at somebody's house in their basement so that we wouldn't get expelled for doing it. But so I've been doing muscle response testing since the early 1970s when I was a student at Palmer. Dr. Goodhart's explanation of the muscle response was it was brought about by an efferent gustatory or olfactory nerve impulse, and that's what created the muscle response. He also made many other contributions to the science, and one of the things he talked about was the confused nervous system phenomenon that we now commonly refer to as switching. My next experience with muscle testing was through Dr. Dick Versendahl, also from Michigan, who was a student of Dr. Goodhart, and he used something called contact reflexes. So President Nixon had been to China, and they learned about acupuncture, and he was using a lot of acupuncture points for his testing. So in this technique, instead of testing many muscles, he was testing one single strong muscle, looking for weakness brought about by what he called an electrical stress. And he acknowledged the electrical nature of the body. He had a polarity point over the bridge of the nose that we still use in MFT and many other energy techniques today. So the muscle response in CRA is described as like being a blown circuit breaker in a house, and that's how he made it real to people by describing it in that way. And you had to reset the circuit with proper nutritional protocol or chiropractic adjustment to turn off that blown circuit breaker. And my next experience with muscle response testing came from Dr. Dietrich Klinghardt, and he furthered this by talking about the informational nature of the autonomic nervous system, and he stressed the balance that needs to happen between both sides of the autonomic nervous system. And he called it autonomic response technique. Autonomic regulation testing was important, and you had to deal with the blockages to healing when the nervous system was not responding properly. He also talked about the energy signatures, and it was called resonance, and it was based on the work from Dr. Omura in Japan. So what I learned from ART is that it's a practical application of quantum physics principles for the purpose of nutritional healing. And we've carried that forward because this is what we believe in. I was fortunate enough to appear in a movie called Take Back Your Power that was just released last week, talking about the problem with the smart meters and the radiation they put off. And Dr. Klinghardt played a large role in that movie, and I got to appear shortly after him talking about how we knew, based on field work, that the smart meters were destroying the body's energy field and what it was doing to the blood. We could show the degradation of the blood. We have found that anything that deteriorates the body's energy field will immediately also deteriorate the blood on dark field. And we got to show that in the movie, and it was very persuasive. As a matter of fact, we've been having a conversation with my town city council and getting these smart meters out of here. And that seems to be going rather well, since the city council is starting to watch the movie now. So I was fortunate to be able to appear with Dr. Klinghardt in that. Here's what's common to all these muscle response testing techniques. They've all used standard process supplements to develop their protocols. Each of these pioneers of nutrition realized that only whole food supplements and standard processes, protomorphogens, have the energy signature they need to actually do this kind of work. And I always say that standard process is more important to me than I am to standard process with MFT, but we could not be doing MFT without the standard process line of supplements. So here's what we bring to the table. We built on the work of these nutritional pioneers, and we took it a step further. Autumn had the inspired idea that instead of doing organ response testing, we should take it down to a lower level. So the cells make the tissues make the organs. So if we can address nutritional concerns at the cell level rather than at the organ level, we can get a better response in our testing. So we use a modified form of muscle response testing, and we draw information from the body's energy field, and we use the virtual energies of cellular resonance in our test kit. That was our very first test kit that we developed. We call it the white kit now, the morphogenic proteins. And in it we have 58 vials that contain the energy signatures of 190 different cell types. Now, some of these energies are normal cell energies, and some of these energies are pathological cell energies. We believe that you can give the body the choice of being normal or being abnormal, which we try to do. And the body almost always will make the right choice and try to be normal. So we now use this kit to replace the body scan. And I like doing it that way. The patients seem to enjoy it because it's much less invasive. Instead of touching them all over their body, you can just wave the kits over their body and get even better results by doing that. So the MFT premise is that the cellular resonant energy vials, which we call the morphogenic proteins, are used in combination with many other energies. We test for about 5,000 different things with our test kits. And it's very structured and practical, and it's a practical use of quantum physics as well. So we can do efficient and accurate testing procedure. We talk about layering a lot of times, how we layered energies together to create combinations of energy signatures that make the analysis go much faster and more efficiently. And we can also demonstrate that the protocols will have a positive effect on the body's energy field, because in the end we take the first measurement of the morphogenic field, have them hold the vials in the field, and it grows and balances the field. So the patients get to see this. Then we prioritize the nutrition so people can see which of those supplements are doing them the most good as well. So we believe MFT complements the timeless concept of nutritional healing. We've been using our food to heal for centuries. And quantum physics has been accepted by the scientific community for more than 70 years, but very little of this science is used in mainstream healthcare. Medical diagnostic equipment uses quantum concepts like MRIs and PET scans, but the pharmaceutical treatments that come from all the diagnosis procedures is still linear, or like Newtonian in its concept. When you have a linear pathway, you're looking for one effect. And in quantum science, we want something that's going to affect the whole body in a positive way. Quantum science predicts that you'll get drug side effects when you are trying to go down one pathway, but other parallel pathways are unintentionally affected. So MFT nutritional therapy naturally has fewer side effects because there's a pre-existing quantum agreement with the body. And feeding the body organic, whole food types of nutrition at the cellular level is a solution to many of these health problems. So how are we different from other muscle testing procedures? Well, we do vial scans rather than body scans. We're not working on the body, so we're multidimensional rather than two-dimensional. We use reference areas, like a liver reference area or a heart reference area, rather than organ reflexes. We can amplify the field. We've developed special energies to make the field temporarily larger. We say this is like having a radio station with a 500,000 watt signal. You're not going to get as good a reading as if you can ramp it up to 50,000 watts. You're going to get a lot better information in a shorter period of time. And then, as I said before, we layer one energy upon another for more accurate protocols. So we begin the procedure by finding attracting energies first, something that makes the muscle strong, and we try to get the body to reject the vial by developing the right nutritional protocol or matching up the energy signatures. We also make sure that the body has all the foundational nutrition. Our red kit is called Foundations. That's the nutrition that all cells need to be healthy, starting with hydration. And then the next two kits, the white kit and the blue kit, address the clinical nutrition. And at the end of the procedure, we always check fatty acid balance to ensure a proper healing response, because the fatty acids need to be balanced to keep the inflammation processes down in the body, and to also provide strength for the cell membranes. So here's why we need to feed the body at the cell level. Healthy cells are needed to make healthy tissues, organs, organ systems, and organisms. So new cells are being constantly created every day, and you have to provide the specific nutrients that that person in front of you needs. And then you need to create other environmental factors that make it ideal for constructing new cells. And we call it the cellular construction project. We look at it like we're building anything. You've got to have raw materials that be the good foundational nutrition. You don't want to build your building on a toxic waste site. So you want to consider purification. You want to consider possibly detoxing from heavy metals, things like that. So we address that foundational need, and then we move on, and then we address the clinical needs. But we do it using standard process supplements, and particularly the protomorphogens. You have to have the right tool set in order to get the right result. So if you're going to build a brick house, better start with some bricks, and standard process is the bricks. Okay. So we'll talk a little bit about that as we go through. We're going to go through some of the standard process supplements that we use, but we want to talk about apoptosis, which is the die off and then regeneration of the cells. How long does it take to create your new body? So the apoptosis is the natural orderly demise of cells in the body. So ideally, one new healthy cell is created for each one that's destroyed. 30 to 70 billion cells are destroyed daily, so you want to make about 30 to 70 billion new cells. And 1 out of 1,000 cells leaves the stage every day. So you're going to be having constant turnover of cells. If we can create an environment where the patient stays on their nutritional protocol through days, weeks, months, years, they're going to be reconstructing their body from the ground up over time. The skin cells turn over approximately every 27 days. Blood cells, 90 to 120 days, 3 to 4 months. Muscle cells, 1 to 3 years. Bone cells, 2 to 4 years. And nervous system cells are regenerated every 7 years. So we're going to start creating this whole new body, and we're going to do it using information that the body itself provides, asking the morphogenic field. So here's what the synopsis is of the procedure itself. We start by measuring the field and quantifying it for the patients and for ourselves as we go through the process. Do the cells have any foundational nutritional needs? And that's the red kit. Which of the individual cells have specific concerns? Well, that would be the white kit. Okay. Then, once you identify which cells have needs, you have 3 questions you have to ask, which is there an immune challenge? Is there a toxicity? And what specific nutrition is required if there is no immune challenge or toxicity? And that will satisfy the needs of the cellular energies we identify in the white kit. Does the cell have its blueprint, which would be the protomorphogens? Are the fatty acids balanced? Is there any unacknowledged shock to the nervous system? And when you get all done, is the field larger and more symmetrical with the nutritional protocol in the field? And we have only 3 rules. 3 rules and goals. This is how we know at the end of the procedure that you've done it right. All of the test kits must be rejected by the field. All of the supplements that you've identified must be attracted to the field, and the field must be larger with the supplements than it was at the beginning of the testing procedure. Only 3 rules. So when we get all done, you just ask yourself, were these 3 things accomplished? If they were, then you can reschedule the patient for the next visit, put them on their protocol, and you can bet that the next time they come back, they'll be doing a little bit better with the bigger field, having a little more energy, and moving in the right direction. Here's what the kits look like. The red kit, foundational kit. Morphogenic protein kit is the cellular energy kit. And then down below we have the blue kit, which is the immune and autotoxemia side. So the testing procedure is really simple. We've got a lot of color coding in here so you can identify which kit you're working with, and it makes the procedure go so much faster and smoother, and everybody can remember red, white, and blue for some reason. So that's the way we've made the kits in the color code. Okay, so let's talk a little bit about foundations. This is basically some of the things we discuss in the first part of the seminar, which is the foundational testing with the red kit. So foundations, things all cells need for growth and reproduction. Our cellular construction project requires hydration, water, proper digestion from the 3 phases of digestion, fatty acid balance, energy from properly digested complex carbohydrates, and then we want to consider the organic minerals. Finally, we want to make sure that the body has the blueprints. So it's hard to reconstruct the cells without the blueprints. You try to do a construction project without the blueprints, you're not going to get very far if you've ever done construction. So let's talk a little bit about the 3 phases of digestion. In the stomach phase, we're concerned with the breakdown of protein primarily, and these 3 supplements from Standard Process assist in that part. So we identify with the red kit the need for either Zypan, betaine hydrochloride, or Calamo if there's a problem with the stomach phase. If there's a problem with the pancreas, small intestine phase, we look at things like Zymex-2, Multizyme, Lactans, Enzicor, and Prosymbiotic. And for the liver gallbladder phase, we talk about these supplements: AF beta food, choline, cholecol, Fensho, beta food, Livoplex, and Colaplex. As we move on to the fatty acids, this we believe is the most important thing that nobody is addressing properly, and we go after primarily these supplements: wheat germ oil, super EFF, chlorophyll complex, Cataplex F tabs, Cataplex F pearls, linum B6, tuna omega-3, black currant seed oil, and evening primrose oil. Also, we also look at sesame seed oil, we look at calamari, and we look at cod liver oil as well. So, okay, also from standard process, we look at sugar handling with these supplements: Cataplex B, Beta Food, Cataplex GTF, which stands for glucose tolerance factor, Paraplex, Diaplex, inositol, pituitrophin, which is the pituitary protomorphogen, pancreatrophin, PMG, and gymnema. And as we go through these, we also want to talk about the physiology that is altered by providing the proper nutrients. How in the world does pituitrophin help with sugar handling? We explain that. Diaplex, Paraplex. Paraplex is a multiple protomorphogen. How does this affect sugar handling? These are all things we like to talk about during the seminar. As far as mineral supplements, these are the ones we focus on: calcium lactate, Biodent, magnesium lactate, Ferrofood, zinc liver chelate, calcifood, prolamine iodine, a huge deficiency, iodine, Phosfood, Calmoplus, Ostrophin, which is my favorite current protomorphogen. It has so many uses that people just do not know about, and we use it extensively in MFT. Trace minerals, B12, Mintran, and organically bound minerals. And then at the bottom of the kit, we check for a generalized toxicity screen, and these are the supplements we use for generalized need for purification. So parotid PMG, Spanish black radish, Cholecol 2, Fengri, and of course the SP purification program. You'll see all the ingredients of that down below there. And of course the primary supplement, which is Catalin. So briefly, the protomorphogens, we consider those to be the blueprints. Those are one of the three things that the cellular construction project needs: the raw materials, the clean environment to grow new cells, but also the blueprints. So the protomorphogen, two really important considerations of protomorphogens: you have to have them for cellular growth and recovery. That's why we consider them to be like the blueprints. But also PMGs aid in the removal of natural tissue antibodies that have to be controlled for proper cellular function. This is getting to be an increasingly important consideration with all the genetically modified foods in our environment. Your body can't deal with them, so it tries to attack them. And with your immune system getting revved up constantly trying to attack things it can't deal with, it'll start to attack you. So they starts to look like autoimmune. So in our advanced seminar, we handle this and talk more and more about how you get autoimmune type responses in the body and how to deal with them from a clinical level. Here is our copy of the Harrower chart, relationships of the hormone system. I like the word hormone as opposed to endocrine because people will come in and they'll see these charts and they will know they've got hormone problems. They may not recognize what endocrine means, but we use this for patient education, but we also use it for practitioner education. What are the roles of these glands, and how do we support them nutritionally using the proper protomorphogen? So here's a little summary of the webinar. MFT provides a two-way communication with the cells on multiple levels. The field picks up information from the test kits and from the supplements that we use to do the testing. The field then sends the information back to the practitioner, who responds to the information. The response of the practitioner is dependent upon the information he receives from the M field. So learning the MFT procedure teaches you how to perform this cellular communication. And that's what we're doing. We're talking to the body. We're going to go right to the horse's mouth and see what the body has to say about what nutrition it needs. You immediately learn what the cells need and give them exactly what they desire. And really what they desire is these three things: a clean environment, organic food, and the blueprint so they can grow appropriately. And all of these things can be provided with the right cellular communication using MFT, or using the right whole food supplement, and Standard Process provides that. So we've got some upcoming events for the fall season, and we'll be sending this webinar out to these areas. So we've got one coming up September 28th and 29th in Pocatello, and we want to thank Dr. Troy Crane for inviting us down there for that. We've got one coming up in Phoenix. If you want to register for that, get a hold of Standard Process Southwest, and their phone number is 920-650-1387. To sign up for Pocatello, get a hold of Standard Process Northwest. We also have an intensive seminars coming up on the East Coast this fall. We've got what an intensive seminar is where we teach both the basic and the advanced in one weekend. And because getting to the East Coast is a little more difficult for me than getting to the West Coast, we try to get as much information in one weekend as we can. So we have one coming up in Manchester, New Hampshire on October 26th and 27th, and one in Hartford, Connecticut on November 9th and 10th. And to register for these seminars, you have to go online to www.m-field.info and then go to our online store where you can register, or you can call our phone number at 360-461-0367. If I don't answer, that means I'm treating people, and I'll call you back. Okay. So we want to thank Dan Schwartfigure for Dan's down in Arizona. So Dan's easy. Everybody calls him Dan. Down in Phoenix. And we want to thank Louis Rufner and Ben Viola, Ruth Pass, and Keith Wrightington in the New England area for inviting us to those areas to teach our seminars. Also, we wrote a book about this, Bugs in My Brain, Poison on My Plate. So if you want to get lots of information about how the MFT procedure was developed and what it is we're testing for and why we have to test for it, we'll have the book available for sale at the seminars. And we like practitioners to also use it as an educational tool for their patients. I sell these in my office, and we go through a lot of them because people want to understand why it is we're doing the unusual things we do with MFT and why it works so well. They would like a little extra explanation about that. Okay, so I want to thank you for attending the seminar today. Here's again our contact information. Remember to go to the website if you're interested in getting information about anything you heard today, www.m-field.info. So thank you for attending our seminar today, or our webinar today, and we hope to see you soon at an MFT seminar. Thank you so much.